I'm Brooke Bishop. This is my audience for my Speech 100 informative speech on IVF. They're going to be sitting right over there behind the camera. That way I, can be looking at the audience and have good eye contact. Okay, thanks. Okay. What do you want to be when you grow up? That's a question that's asked often when we were younger. A lot of kids answer with many things, such as an astronaut, a princess, the first president of the United States, many answers. Unlike my fellow playmates, I never answered those questions with answers similar to those. Mine was always different. Answer was a mom. To me, I knew that having a family at a young age was very important, and I knew that that was what I wanted in life. So imagine my surprise when I figured out a few years later when I got married that conceiving naturally would not happen for me. It would take a complex process known as IVF, or in vitro fertilization, for that to happen. The reason infertility in women is important to me is because I am one of the 7.5 million Americans who can't get pregnant without the help of medicine and science. Those statistics come from the Center of Disease Control and Prevention. In vitro fertilization, otherwise known as IVF, has 5 main steps to it. It is known as, the first step is stimulation meds, and then there's the egg retrieval, there's petri dish science, the embryo transfer, and quantitative labs. So we're going to go ahead and take a look and start at the beginning. So step 1 is stimulation meds. So what that means is for 10 days, once a female gets her cycle, she'll be taking stimulation meds known as FSH, or follicle stimulating hormone. These hormones help the women grow more than one mature follicle. So, for example, a few types of FSH medication that you might be taking is going to be Gonal-F, Menopur, or Follistin. These are all injectable medications, so you use a needle and put it in your stomach on either side. So, along with taking stimulation medicine, the woman is also monitored daily. So you have many appointments over the course of the 10 days that you're on your stimulation meds. Every 2 to 3 days you'll go in and they'll do a pelvic ultrasound to check and make sure that follicle growth is growing well. As well as you'll also be having blood work done daily to make sure your levels are fluctuating in the right direction. Step 2 is called an oocyte retrieval. So a more common name that people refer to it as is an egg retrieval. So when this happens is once the 10 days is over of your stimulation medication, then you'll have basically 2 bunches of grapes on each side in your ovaries, and those need to be removed. So in order to do that, you will undergo light anesthesia to be kept comfortable and pain-free during the procedure. So once you're put under anesthesia, a small 17-gauge lumen needle, also known as a very, very tiny needle, will go in while you are under anesthetic through the vaginal wall into your ovaries to retrieve those eggs. That needle is going to be guided by ultrasound, so you will not feel a thing because you'll be asleep and you'll be in very little to no discomfort once you wake up. Pure human reproduction, the oocyte retrieval, is also known as an egg retrieval. So you'll kind of hear people refer to them as 2 things depending on the level of knowledge you have in the medical world. Kind of just for today, I'm going to refer to it as an egg retrieval because then you guys will understand kind of what I'm going through. Step 3 is petri dish science. So once your eggs are removed out of your body, it's kind of your hard work is done. So that's when the real magic happens. Doctors will take a fresh or frozen sperm sample from either your husband or whoever you're doing IVF with, and they will inject a single sperm into a single oocyte or follicle, which is what they removed from the female patient. And then with doing that, that single sperm that's injected into the single oocyte is known as ICSI. The real long word for that is going to be intracytoplasmic sperm injection. This is when, during that process of fertilization, that's when it goes from being an oocyte into an embryo. So step 4 is also known as the embryo transfer. So with this, after 3 to 5 days of your embryo incubating in a lab and growing, hopefully, based on your doctor's advisement, there are 2 options. You can either do a fresh transfer or a frozen transfer. So a fresh transfer happens exactly 3 to 5 days after your egg retrieval, and it's the most natural form of IVF you can get. The only downfall to a fresh transfer is going to be that the hormone levels in your body are still high, your progesterone levels are high, so it can possibly create a hostile environment, causing embryos not to implant. But some people do prefer to go with a fresh transfer just because they're so anxious, they can't wait, they want to transfer and hope it works. They kind of are just wanting to get the ball going, or they want to do a natural IVF and as close to natural conception as possible. The other option is going to be a frozen transfer. So a frozen transfer is also known as a FET. After 3 to 5 days of incubating in the lab and fertilizing and growing, your embryos will all be cryopreserved, meaning they're going to be flash frozen. That means you're just going to freeze them all. They're all going to be frozen. It's a process using liquefied nitrogen to liquefy all of the embryos. This allows for the patient's body to kind of normalize. It allows for a cycle or two in between your retrieval and when you're going to transfer. It allows for your hormone levels to go back down, to neutralize, to be back to normal, which ultimately would cause less stress on the patient and allow them to have a successful transfer being under no stress. This can also help create a less hostile uterus. So your lining will be thicker and everything will just be better normally when you do a FET transfer. Step 5 is going to be your quantitative labs. So with this, you transfer the embryo back. 7 days after that, you go in and you get blood work done. If your levels are above 5, your HCG hormone, which is the pregnancy hormone, will be good to go, and then you're pregnant. So that's kind of how IVF works. It's a very complex process for women, and hopefully you're not one of the 7.5 million Americans who have to go through that.